Hello, everyone. Welcome to our webinar today on From Policy to Practice. We've got a great session today, a great group of panelists, a number of really important things to take you all through today. I'm sure everyone is pretty excited and breathed a very large sigh of relief with the announcement that we've got some extra time to prepare. So this webinar is really important for that and to help give you some guidance and some policies and practices and things that you can implement into your organizations as well and things to consider. So that extra time was very welcomed by most people, I believe. But also while the extension gives us all that extra bit of time to prepare and to be ready, obviously very conscious that the department and the commission will also have those higher expectations now with the additional time that we all will be ready for these changes going forward. To start off today, we'll just also like to acknowledge the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders peoples today as well. This event also qualifies you for 1 CPD point, so please add that to your log for those in attendance and that are going through that program as well. Also, there's always questions with these. We want them to be interactive, so please, by all means, add any questions into the chat. We have Chris monitoring the chat today, and we'll also come back to those chat questions and pose some of those questions to our panelists. So please engage in that process as well. And as always, these sessions are recorded, so if you have any audio or technical difficulties, this will be recorded, so you can always come back and watch and share with your colleagues as well at another point in time. So essentially what we'll do today, our agenda is we'll kick it off, go through as we always do with our key and important survey findings. We have a lot of attendants today that have registered and obviously answered a number of questions before attending our session today. So we've got some really good insights to share with you in regards to those survey findings. Then Taryn will be taking us through understanding policy to embedding practice. And then we'll be hearing from our panel. Again, we've got a great panel today, which we'll touch base on later today. But we've got Nicola Burton from Peninsula Villages. We've got Angelica Copland from Australian Aged Care Group, and Victoria Mills, the CEO and founder of Hello Coach. So we'll hear from them. Victoria will also then take us through a bit of change leadership and some coaching things that they do and some practices that you can incorporate into your own organizations. And then we'll come back to the panel for some more questions. Follow up with your questions from the audience through the Q&A, and then we will wrap it up hopefully on time today for everyone. But to get started with our survey questions, as we always do, one of the questions that we asked at the start was, where do you feel your organisation needs the most support to prepare for the 2025 reforms? And as you can see there, 38% through compliance and regulatory planning, which is no surprise, closely followed behind workforce planning and training, and then shared between leadership and change management, communication with boards and stakeholders, with financial operation and modelling, and then a small amount with the communication with boards and stakeholders. So not surprising there, obviously, there's a lot of compliance that needs to be done, and obviously with the workforce issues that everyone always seems to face and around education, also important with regard to workforce planning and training. Then we have, have you started a formal transition plan aligned with the New Aged Care Act? And that's great to see that we have 71% said yes. We were approaching this time frame. I also think a few of those respondents may have registered for the webinar early. I would say that we've probably got more than 71% now. That 18% of planning to start soon are probably all well underway. However, there are obviously some that still, very, very want clarity around that, and some clearly not sure where to start. So hopefully this will help guide some of those people where to start and some of those tools and practices that you can implement into your own organization. Then we looked at which team in your organization feels the least prepared for these changes. So again, very, very common, clinical care teams, 38%, followed by finance and operations, which we would sort of expect to see with obviously the new standards heavily impacting on clinical and care teams and the knowledge that their staff need to know. And obviously with finance and operations, looking at higher everyday living fees, the changes to accommodation agreements, around retentions coming, indexing of DAPs, non-clinical care contributions, and so on. So a lot of significant change there. So not surprising that a lot of homes and organisations feel the least prepared for those at this point in time. I'm sure we will get there over the preceding couple of months, but also then compliance and governance, followed up by HR workshop, workforce planning, and executive leadership. Then we looked at what format of support would be the most valuable for your organisation. It's probably the most important takeaway for today. How can we help you? What can we help form that discussion? So very, very strong, 55% want clarity and consistency from the government, which we can't help you with today. Obviously, we're still waiting for the new Act and standards to finally drop and come out of draft format. So hopefully we will, over the coming months, get a lot more clarity from government and a lot more tools and documentation that will help us and all the organisations prepare and get ready for that 1 November deadline. But outside of that, templates and checklists, which is always wanted and needed within organisations to help navigate the changes to make sure that they're not forgetting anything and they're staying on top of all those key important things. And then also peer case studies and leadership insights at 13% there as well, which do also help provide some guidance. And hopefully we will have some of those insights for you today that can be shared by our panelists and what they're doing within their organisations. Now we'll hand over to Tara and to take over here around understanding policy to embedding practice.
Thanks, Ben. And thanks everyone else for joining us today. We're talking about what it really takes to move from understanding policy to actually embedding it into practice under the new Aged Care Act and everything that it brings. This is not just about compliance in theory. It's about getting your people, your systems, your processes so well aligned so that the intent of the Act actually shows up in your day-to-day care that you're providing for the individuals at the end of all of these services in our businesses. And when we start with where the sector is at, that polling is so helpful for us to know, but also for you to know where everyone else sits. In the last webinars polling that we did in the May webinar, only about 8% of providers said that they felt very prepared for the reforms. The vast majority, about 80%, said they were somewhat prepared, and about 9% not prepared at all. Now, not just numbers, I realize, it's very much what we're hearing in subjective conversations that we're having with providers every week. There is that growing sense of pressure, not panic as such, but a growing feeling of, we know what the Act says, we're just not sure how to make it real across our teams, our tech, our budget. And no doubt part of that ambiguity, as Ben said, stems from the fact that we don't have the full legislation and the rules yet. But at the same time, the barriers are still pretty consistent. What is holding providers back? We know they're telling us that it's really unclear what the practical steps are that they need to take. You want fewer policy summaries and more hands-on tools, as we saw in the poll there. You're asking for things and questions like, how do we demonstrate embedding rights into practice? What does good complaint handling look like in the new expectations? Where do we even start with continuous improvement as a lived system? These are the themes that are coming up in the trainings that I'm conducting or the partner conversations that we're having. This is also a bit of a leadership challenge in itself as well. And I can't remember where I saw this over the last couple of weeks. I've seen this come up again and again, and I wish I could credit the right person. But I've seen this theme come up that someone's very rightly said that governance is no longer background noise. It's much more center stage now. And there is this urgent need, obviously, for boards and executives to really step up, because reform then is not just for the quality or the governance team. This is an organization-wide pivot, and leadership, good leadership, will make or break the transition there. So this policy to practice gap, we've been calling this a bit of a last mile of the reforms because it's been going on for so long since the Royal Commission actually launched 7-ish years ago. Um, this is where the real challenge is, which you already know. We hear this all the time of we've read the documents, the bajillions of pages that there are. We need help to actually operationalize it. And this is what policy says. You must do this or that. Practice actually asks who's responsible, how often does the task happen, what evidence proves that it's embedded. That's how we're translating reform into operations. Because this is what we're seeing with the providers that are struggling. It's not the awareness as such, it's that translation that needs to happen. So with that all said, I think there's three key things that people are starting to look at more and more. A bit of trend that I'm seeing. One is leadership and starting with leadership. As I just said before, that key message coming through from providers is that governance structures really need a reset. Not just about the compliance checklists, this is much more about embedding the reforms into culture. So providers have shared with us that boards are committed, but we're not sure and we're not confident that the operational layers understand how to actually cascade the reforms into practice. We're also seeing a bit of a significant gap in leadership development in itself. And I'm sure Victoria's going to touch on it in a bit, but if your people leaders are not confident, things tend to stall. So boards really cannot be affording in the future to see this as an issue for someone else in the organization to figure out later. The other trend that I'm hearing more and more come up is technology. And for good reason. We're hearing fragmented systems are slowing down reform efforts. Teams are getting bogged down in duplicative reporting, perhaps, or chasing compliance data across platforms, and really struggling to connect different functions in the organization, like quality with workforce, with finance. So integrated platforms and interoperability is coming up more and more in conversations. Mirrors Plus is an effort to go towards that as well. But when your data speaks to each other and you free up your staff to actually focus on what matters, the actual quality care, rather than spreadsheet wrangling, perhaps. And the last thing that I want to touch on that we're hearing more is ongoing training and capability building. Now, we're hearing that strong demand for ongoing training, not one-off. And leaders are saying things like, we don't want to just tick off this act. We want to build internal capability to manage reform going forward, because realistically, 1st of November now is not just the start of it, is now just the start of it, sorry. And there is still a long road ahead. So Academy tries to bring that in with short, sharp, practical sessions, but at the same time, transition support program that we run is getting more attention with the strategy and the planning sessions that we have, the diagnostic reviews, the workshops and briefings that actually go beyond just information provision into actual implementation and the advisory support that comes with it. The real on the ground the sentiment that I'm hearing still is that everything we do is still built for frontline. Because if the reform doesn't land with the people that are actually doing the work, then it doesn't land at all. On that note, I'll pass back to you, Ben, to hear more from the panel and what they think of it all. But these are the three key things that are coming up for me: leadership and tech, and training and capability building for me. Ben, back to you. Thanks.
Thanks, Taryn. I think that's a great segue across to our panel today, to actually go to the people on the ground that are dealing with this on a day-to-day basis, and how they are working with their teams, and how they're starting to roll out and update and educate on the changes. So today we'd like to introduce, as I mentioned earlier, Nicola Burton, the Executive Manager, Quality and Organisational Development at Peninsula Villages. and Angelica Copland, CEO at Australian Aged Care Group. And then we'll come to Victoria after this panel to then go through some information with her role as founder and CEO at Hello Coach. So I'll throw it across to Nicola to start with here. Just in regards to asking the first question is, well, what is your experience so far, Nicola? How's your organisation been dealing with this? I'm assuming you breathed a sigh of relief to have that extra time to prepare your teams.
I think we all did. I don't think there was one person that didn't feel very relieved when we heard the news about November. We've tried to approach it with probably a bit of a tiered approach with how we're looking at the reforms. And Taryn, you're right, we've been dealing with reforms for, as you said, close to the Royal Commission. So this isn't anything new. And I think as an industry, we've always risen up when we've needed to, and we've met things when we've had to. What we've done here is we've tried to be practical about it, and there's certainly a governance level that some reforms fit into, and more of an operational level. So probably at a governance level has been, I've used the Department of Health and Aged Care, or Disability, what's called now, the Operational Readiness Priority Actions Checklist. I utilised that and put it into an Excel format so we could all see who was responsible and what we had to do. And I think sometimes when you look at reforms, they feel so big and there's so many things that you have to do. Sometimes being able to drill down and actually break it into steps makes it more manageable, and it makes it, I think you can actually have a bit of a snapshot of where you are and where you need to go. The biggest piece of work we've really undertaken is the work with the strengthened standards. And we've taken the approach that we didn't want to do a ticker box, as you mentioned, Taryn. We wanted to increase our organisational capability and our workforce capability. And with every action under the outcomes, we wanted to be able to demonstrate and prove that we had the evidence and that we could, or we were auditing, or we were actually able to show that we meet it, rather than just saying, well, I think we do that. Oh, we've been doing that for ages. Because it's really easy when you're working with standards to think that you've already done it, or you already have it underway. But sometimes proving it can be a different story. What we did, I have a great team. I'm really lucky. I have a really engaged learning and development manager and clinical governance manager. And my clinical governance manager spent a lot of time working through each theme. So we used the evidence mapping and the all of the actions and the request for information, and she used ChatGPT to put them into massive self-assessment tools. And we conducted workshops with the people who are the operational managers, and they're the subject matter experts. And I think we have to really recognise the role that they play. At a governance level, it's very easy sometimes to say, well, we're going to do this or we're going to do that, because we think we know what needs to be done, but we don't truly understand that process. So I think that's a really important point from a leadership point of view, is really engaging the people that know the processes, but also the people that are going to have to roll out those changes. It's sometimes you can look to a more of a directional leadership model where you can say, okay, we need you to start using this form. But when we're looking at workforce capability and behavioural changes within our workforce, that's where you really need that change management piece and the leadership to actually embed those changes. Otherwise, you do them for a short period of time, then they just drift off. So, and I know, Victoria, you're going to touch on that. On that further. So we spent probably nearly 30 days doing one-day workshops for the themes, and went through them really extensively. So we know exactly what we have done and then what we need to do. So the next step for us is that project plan part of it, which we'll speak about later. But that's overall how we approached it. But things
any key hurdles, Nicola? Like, is there any challenges that you faced from, obviously we've all gone through these different reforms and multiple standards changes and funding tool changes? Were there any key hurdles or difficulties that staff have shared with you in regards to the upcoming changes?
I think the hardest thing is the volume of information and how rapidly it changes. And something like the care minutes, feel that you're completely across that, and then a new guide comes out that you haven't spent the time reading because you think you're across that, and actually things have changed. So you actually have to be very intentional about making time to really read through things in detail to make sure that you understand them. And then, so when I described our self-assessment process, I started doing the PAC tool that was available from the Commission. That's now changed, and we need to do a lot more data collection. And for the audit evidence collection tool, we need different information than what we did. So we've got to go back to the drawing board a little bit. So sometimes starting too early, you think you're organised, but it kind of shoots you in the foot a bit too.
Yeah, and I think that probably also reflects in the poll question in regards to clarity from the department around why are the changes, what is happening, and it is so challenging with everything being in draft form and then moving, and then you log on, and there are different sources and avenues to get information, whether it's from the department's website, the Commission's website, and then quite often it's sort of just put on a page and no one really knows it's gone up on the page and it's live. There's no sort of formal process. So I guess if we have anyone from the department listening, it would be nice to have a clear section or area where we can identify easily what are the latest the documents that everyone should be focused of, and announcements, especially when documents are changing, and good version control, considering most organizations expected themselves to have amazing version control on all of their documents too. All right, so I'll throw it across now to Angelica Copland, CEO of Australian Aged Care Group. If you'd like to let us know, how have you found the changes, and how's your organisation been experiencing so far with the new standards and Act coming in?
I had to smile a little bit when I heard Nicola talking, because I did exactly the same thing. Great minds think alike. We used the operational readiness priority action list the department issued, but obviously we adapted it to our own organization. So we ended up with 44 different actions that we had to attend to in preparation. And all these different actions I have put in a spreadsheet again, and have allocated to, to our team members, leadership team members, from finance manager to quality manager to general manager and so on. And I've also made sure we put obviously due dates in, which now the sprint is over. We can extend these a little bit, and we're very grateful for that, because all my due dates, looking at it, was all the 29th of June. So they're not, obviously we have a bit more time, which is really handy. But what I've also done is I have used the information and the links that are on the Commission and departments' websites, and I linked them all into the different actions. So it makes it a bit easier for my team if they have to, let's look for some information or issue a letter to the residents and families and so on, that they can actually, they don't have to look around on the websites, and they have the link right there. That obviously also means the links have to be working, so I have to keep on checking them, because the department tends to change things. But the feedback from my team was that was very useful for them to go through, and then obviously they have to report back in what they have done. But for me, as the CEO, a big thing, we run additional services and extra services. For me, it was a big thing to actually look at the health at the higher everyday living fee, and review all our current additional services schedules, extra services schedules, and come up with a plan how we transition that into the health schedule. And that poses quite a few challenges, especially for extra services that are set out on 3 different levels: accommodation, food, and lifestyle. And because we have a 12-month transition period, it's going to be a problem how to do that in practice, when residents decide still to stay on the current schedule and then the new ones come in. How do we align that? We can't have residents sitting on the same table, and one resident has a choice of 2 meals and the other one has a choice of 3 meals, or whatever it is we come up with. So there are still a lot of practical challenges in regards to the health, especially. What I've done in preparation, also, we had leadership meetings, and I actually asked the people on the floor, what do you think residents really want? Because it's all good to have an additional services schedule or an extra services schedule, but is this really what the residents want? What are they asking for? And then we came up with a list of possible health schedule that we could introduce. And we're still working on that. Obviously, I thought I had to finish it all by the end of June. But now, luckily, we have a little bit more time. And I just take this as an opportunity for improvement, really, and align what we are offering more to the wishes of the residents and what they are actually prepared to pay for, rather than directing them towards a schedule that's sort of pretty rigid and might be things that they don't even want. So I found it a challenge, but I also found it an opportunity. And the other thing we did is, in regards to training, workforce training, we use the ALICE, the department ALICE system, and we allocated extra resources to our general managers to be able to roll that out, the different standards. And we are still in the process of completing the training. But yeah, again, I found that very useful. Obviously, there's a cost, there's a cost involved in whatever you do. So there's a lot more training. There are a lot more training expenses at the moment for our staff on the floor and the RNs and so on. But that's what we need to do. So yeah, using the ALICE was a good thing. And on top of that, we will then do a training needs analysis and see what else needs to be taught over and above what's in ALICE, and use that with a toolbox system. So that's going forward. Also, the things that we come up with in that schedule that I talked about, the operational readiness list, we also put the bigger items into the continuous improvement plan. So we have a way, to follow up on that if it has been done or hasn't been done. So that's where we're at. But we got obviously also plans in what we are doing going forward as well. We have also reviewed our complaint system, because that's a big thing as well, making sure, and we're running with Manat, obviously, that everything is aligned to the new standards. One difficulty we have, one of the facilities is actually now being accredited until November, and we thought, okay, we all go with the new standards, but now it looks like we're going to be accredited and assessed against the old standards. So we can't actually now throw everything out and say, okay, let's go with the new ones, because for one of our homes, we will be assessed against the old ones. So that's another hurdle we have to overcome. Yeah.
I was going to ask you about hurdles, and that's definitely a hurdle to have your staff and teams juggling, focusing on the new, but also maintaining the old, and being ready for when the commission come in and obviously go through and perform that audit. And what's the I guess, what have your teams and management fed back to you? How are they dealing with the changes and the understanding about the upcoming reforms? Have you had any other specific hurdles or feedback from staff members?
Not specific ones. I think we're pretty organized generally, because we're using the Manat system as our care management system. So we can audit at any time, in regards to what the what the assessments look like, what the care plans look like, and we always try to provide really high quality, quality clinical care. So it is our view that in regards to clinical, there are not really that many changes if you provide really high quality clinical care under the old standards, and you align yourself with what's required under the best practice. So there shouldn't be too many new things. But obviously we're also using the Manat system, so we're sort of trusting that we're getting all the tools in the system that we need, and follow the yellow brick road, so to speak.
Yeah, fantastic, great. All right, so let's move on. So next up, we have Victoria Mills, the CEO of Hello Coach, to just take us through a bit more around change leadership and coaching offerings and what they do as well.
Thanks, Ben. It's a very good segue. Hello, everyone. To continue on from what Nicola has shared, and Angelica, thank you very much. I've had the very fortunate position to being on the front line with a lot of aged care facilities. We are obviously a partner with Mirus Australia. And I've had the opportunity over the last 12 months to have some up close, very transparent conversations with some aged care facilities that we support. And the number one thing that I've heard today is the importance of preparation, and planning. And particularly when with the reforms, the standards changing, it is not so much about, making sure that you've got the checklists, but it's looking at where are the gaps and how can you support the teams. And I wanted to start with a very relevant example of one of our clients, just to give some relevancy. So this client has over 600 beds. And I know that we've got a large cohort here today, which is fantastic to see. Multiple sites, they reached out to us last year and obviously struggling with what we call exceptional people on the front line, where you've got exceptional clinical care teams, facility managers, that they've been promoted in roles. A lot has been promoted over the last couple of years, but they're lacking some leadership skills. They've got exceptional clinical experience. And so where we come in and support is taking cohorts through, it can be anywhere from 10 right up to 100 and more. And we support them with the foundational training in the people skills side. So that change management piece becomes very critical. So one of their challenges that they had that we wanted to tackle last year was obviously silo teams. And you get this across facilities, period, where what we do, we bring together cohorts that they may not have the opportunity to have conversations. We educate them and take them through a training program, which I'll take you through in a few different slides. And it allows that cross-pollination of conversations, but most importantly, the embedding of skills that the clinical team and the frontline leaders may not have access to. Because at the end of the day, executives, teams, and C-suites will certainly have that background of experience. But what we're finding is that the clinical side and the care teams are the ones that have been lacking in terms of helping support them in more of the people management side that goes a long way with their roles. So we technically go in and we deliver live learning workshops, and we can have several hundred on that call. And then we support them with the one-to-one piece. So we have several hundred change management coaches on our platform that go into organizations. I've built a technology platform that allows the deployment of our coaches to go into organizations to help support the embedding of the learning that comes off the back of our workshops. We also support some aged care facilities that may have exceptional existing leadership capabilities, and we will then support them on the embedding of that learning with the one-to-one coaching piece. So there's lots of different ways that we support facilities, but we have seen one of the reasons why we partnered up with Mirus, there was a big gap from just leadership skills. And Karen, you were saying this before, it's the ongoing training and the capability training that is key. It helps them not only deal with the current stress points, but also sets them up for success with the reforms, with the change in standards and all the plans that obviously, Karen, you said a very funny point. What did you refer to it as? Wrangling spreadsheets. It's no different when you're on the floor. It's about equipping them with skills to deal with the here and the now, as well as future proofing. And we do obviously believe that change management is definitely, it's the new frontier of leadership, and it's critical and it's key for all organisations, and particularly with aged care. So Ben, very happy just to go along to the next slide. So one of the areas that, we really tackle is amongst the, it's the value of change leadership. Why? Frontline leaders particularly are smashed with so many different conflicting pressure points. And we've heard here today, whether it's technology, whether it's new reforms, whether it's new acts coming through. Change leadership is one of the critical enablers of transformation in the aged care space. We know that. And the importance of driving alignment between reform mandates and operational readiness and frontline care. Pressures are enormous. They're not just being hit with crisis response plans, also consumer expectations, family members, digital transformation, technology, regulatory reform. So there is massive pressure coming from literally wherever they look. So one of the things that we support teams in is being able to look across, firstly, finding your gap. Now, we've heard here today that, Angela, thank you, and Nicola, you're very much across a lot of these systems and you've got support in place, but a lot of aged care facilities are still in the dark and they don't necessarily have the right support and training in place. So I just wanted to do a very quick poll here. It's anonymous, but I like to be able to get a read of the room in terms of how prepared are you for some of these leadership gaps with regards to aged care reform. And there's a poll that's just come up here. I will hang out here for about a minute. Love to get your thoughts on how ready you are and how prepared you are. Do you have systems in place? Do you have training in place? How are you supporting your clinical and care teams across workforce pressures, consumer expectations, digital transformation, the demographic shifts? Crisis response is a big one, and regulatory reforms and values-driven care. love just to hear how prepared you feel that you are in relation to your leaders and your frontline leaders, because they are the ones obviously literally on the front line. So just give me a hands up when you've done the poll before we close the poll. I'd love to hear from everyone today, because you are definitely the ones on the front line, and it's always good to get an example of where the pressure points are still existing. So just continue to give me a hands up when it's done. This is where we need to break out to elevator music. Tara, would you like to sing a song? Ben?
Interesting numbers coming in though. I can sort of see them coming through the poll results now. So some interesting information, I think, and not unsurprising in some respects too, especially around workforce. Always a key area, especially in aged care. Always has been, and I probably always will be, a key concern.
Definitely. And you know, there is the changes are coming in thick and fast, and we have seen, particularly with what we do, I mean, we're agnostic. We support a lot of organisations, but particularly the aged care space, it's a much needed area to go in and support leaders. And one of the things that's always, you don't know what you don't know until you do need to work fast and put a plan in place. And the conversations that I've had with quite a few of our clients, it is the preparation and it is the planning for the future, as well as dealing with the now, which is where the change management piece comes in. So Ben, why don't we take a snapshot of those results? I would think that everyone...
Yeah, so looking at the numbers, so obviously, not surprisingly, leading with 65% responses is workforce pressures, which is, not surprising. And then obviously regulatory reforms coming in at 55% behind that, followed by crisis response at 43%, digital transformation at 42%, consumer expectations at 31%, and demographic shifts only at 8%, according to the audience.
So that's really interesting. I would say definitely that 65% on workforce pressures. I'd love just to throw out to the cohort here today, out of that workforce pressures, what would be the number one pressure point? I know that was a very high level snapshot, but is there something specific? I know we heard from Nicola as well and Angelica. Very happy just to throw to the floor. I would love to hear from you, because this helps us. I'm all about data and feedback to continue to make sure that we're able to keep creating the right content for our leadership programs. Is there someone that would love to put in the chat or share vocally on what the number one workforce pressure is that you are seeing amongst your teams?
Angelica or Nicola, have you got some extra info to share on what the key issues around those workforce pressures are?
Staff retention.
Well, yeah, it's getting the right staff, the staff qualified enough. Very often we found with the PCAs, for example, that we get, even though they have their certificate 3 or certificate 4 or whatever, we need to retrain them into our systems and what our expectations are and what our clients and our residents want. So that, I think, is a big thing. It's not just one day of induction, but it's buddying people up, making sure they understand what is required. Very often they come from other organizations and have their own ideas how things should go. And there's quite, a bit of time and effort required to train them up to our standards. Similar with registered nurses as well. And generally being able to get permanent staff, because there seems to be a perception out there that, I work casual and I can use my shifts. And when you have a highly casualized workforce, it also means that very often they do not turn up, and then all of a sudden you have agency in. And that's not only a financial issue, that's also a quality of care issue. So grappling with that and getting away from a casualized workforce to a permanent workforce that's trained up to our standards and wants to hang around and understands what we are trying to do. I suppose that's one of the biggest challenges for us.
Thank you very much. Look, we've seen here, thank you so much for all of that incredible information. Workforce pressures, yes, staff retention, retaining quality staff, hiring staff, capacity for managers and middle management to deal with changes on the fly and on the go when they've obviously got a very intense workload as well. Recruitment is certainly at the top, embedding and shifting culture, change of mindsets from task orientated, change of culture. And this is where we step into organizations that these are soft skills that people are, that, you know, frontline leaders are missing, because that, you know, there's opportunity, recruitment. Yes, you need to maintain your staff. And it's also about giving them the tools where they feel competent in being able to deliver on their roles, because there is enormous pressure on the front line. So a few things just for you to have a think about now, as you're going about your day. There's some strategies to reflect on. I've heard here today that, yes, there's lots of spreadsheets flying around and there's lots of templates. You know, do you have structured frameworks in place? You know, embedding change impact assessments and readiness reviews. Do you have something like that in place? And this is just a bit of a tick box. Tailored engagement and communication. So co-designing engagements with residents, families and staff. Being able to take them on the journey and listening to them, you know, what do they need? How then can that translate into a change or a shift in some training? Capability building, I've heard this today. Leadership coaching for change champions and care leaders. Your biggest avatars are the ones that are on the floor, and those that have been promoted into those roles where they have exceptional clinical knowledge but lacking some leadership skills. They end up being the internal champions to then drive the culture, to then being able to influence and motivate their teams around them. Do you have something like this in place? Cultural change and trust building, promoting psychological safety to enable staff to speak up. Again, some of this might not be new to all of you, and you know, sometimes you think, oh no, we do that, we've got it covered. But do you really? You know, do you have systems in place and or training in place where it does create an open culture for feedback and communication? Governance and sustainability, establishing cross-functional change governance groups. So these are just some things to take away from today, to honestly look at. Do you do them? How well do you do them? How can you measure it? And what are some of the gaps? So very high level, what I wanted to go through, actually, Ben, if we could skip a slide and just go to some of our capability developments, just to give you an idea. Hello Coach steps into aged care, and we support not only from a team development, but a one-to-one. So we use our workshops where relevant, and it gives people, I call it conscious competence, where they have an awareness and they have a aha moment. It could be around tough conversations. It could be around delegation. It could be around giving and receiving feedback. We cover off several hundred topics in our workshops. These are the ones that are our trending ones that we're obviously delivering the aged healthcare space. It's leading through change. The purpose of this particular workshop, it's talking about foundational leadership and mindset. Mindset is critical. It starts and finishes with mindset. And it's very often that you'll think, oh no, I've got a really open mindset, but in fact, you've actually got quite a fixed mindset, where we take people on the journey. And if we're encouraging people with a framework and activities to actually let them go on a journey in terms of where they are, where their mindset is. Do they have a growth mindset? Are they open for, are they resilient? Are they open for being agile on the floor? Again, critical skills needed. Communicating through change, strategic communication during times of change, what those communication models look like, what the frameworks look like. So we come in and we support you with those frameworks. Resistance to resilience, emotional intelligence and stakeholder engagement, being able to manage relationships, effective listening skills, relationship building skills. Change leadership in action, translating change strategy into operational outcomes, leading change across boundaries and silos, and sustaining momentum and avoiding change fatigue. And these are some of the areas that we cover off when we come into organisations. And these are just a snippet of what we come in and help support you in some of your leadership initiatives. And, you know, everyone is time poor, and everyone has got pressures on the front line. And if you don't have an internal leadership structure, this is where someone like us can come in and support you on that. And it could just be in a handful of workshops, it could just be in a handful of coaching. We've got the ability to be very agile with our clients to give you the content and the delivery outcomes that you really need. So that's essentially it from me. So thank you very much, Ben. I know that we've got a QR code here. If you would like to have a separate conversation offline, we are part of Mirus Australia. All you need to do is scan that code. Very happy to jump on a call with you and see where we can support you. So we're here to help. Aged care, I'm very personally passionate about, as we all are here, because we're here because of that. So please, just if you want to, just scan it, and I can certainly be in touch with you. Is there any questions from that?
Well, we've got questions in the poll, so anyone has questions, we'll come to questions at the very end. Thank you so much, Victoria. That's some great insights onto leadership and coaching and some change management topics. So hopefully some key things for some the people attending today to go through those lists and see what they're doing internally. And by all means, if you're looking for help and assistance with coaching of your teams, then Hello Coach obviously is available. But some great information for them to take away around change management, to reflect and review on what they're implementing themselves. So we're going to come back to the panel now again, and by all means, there are questions coming into the chat, hopefully. So please continue asking those questions. If there's anything of Nicola, Angelica, or Victoria that you would like to hear from, we will come to all the questions at the end. But we're just going to throw back to the panel now. Again, starting off with you, Nicola. Just coming to, what were you looking at doing now going forward? So we've obviously got this little extension, a little reprieve and time to have that extra preparation. Obviously, you're well on the path, and you've obviously got a very structured process that you're working your way through, looking at the standards and the ACT changes and the impact on your organisation. What else are you doing now? What's on your roadmap for the next, what have we got, 4 months to get to that deadline and make sure that all your teams are ready?
So I think on a practical point of view, the bulk of the work sits with wanting to demonstrate that we meet the strengthened standards. Our registration expires early next year, so that's probably our focus at the moment. We are now distilling all of the work that we've done that's sitting massive Excel sheets into a project plan so that we can really rationalise what we need to do. We can implement it in smaller stages so that it's not overwhelming for operational leaders to have to try to do everything at once, and really prioritise what we're doing. The second part is really looking at our workforce capability, and I think when you sit in a governance role, it's really easy to understand the standards and what they mean to you as an organisation. As a frontline worker, though, it's quite external and in a bit of the periphery, really, around what you're doing. It's a framework, and it's not necessarily so meaningful for them. So where we want to see things around behaviour change, around approaching trauma-informed care, or demonstrating consent with every episode of care, actually changing around the model of care and how we deliver care, that's where we really are trying to come up with some really innovative training ideas, with training that isn't just being spoken to, it's how it, what it means to the person who's actually delivering the care, the service to the person, and really trying to make it meaningful, thought-provoking, and actually wanting them to change their practice. And Angelica, reflecting on what you said, we're really fortunate that we're fully staffed, but we're seeing much more of a transitional workforce with people who are experiencing much more financial pressures and have 2 or 3 jobs now. And we're trying to make sure that all of our workforce is aligned and we're all delivering the same care. I think the task-based changes is easy. It's the actual getting people to change their practice or their ethos or their approach to things. That's the difficult part. And, you know, picking up on what Victoria said, that's the real change management piece that we need to look at. So that's really where we're at, and making sure the concepts that are coming through, like I mentioned, the trauma-informed care, registered supporters, and the idea of consent, and people's families have different expectations what they had even 10 years ago in aged care, making sure that we meet those expectations, largely around communication and involvement with the resident coming first. So I think that's probably where we're really aiming at now. So probably a little bit big picture, a bit more, and a little bit of practicality with it. We use ManAd Plus, and we've been really happy how responsive they've been to trying to make sure that we have all the tools. So our next step is, after our project plan, is to get it into our CQI plan, which sits in ManAd, so that we've all got visibility, but also so that we can show the Commission that we know what we need to do and we have a roadmap as well.
Yeah. And in regards to that, you mentioned obviously this has all been about change management, obviously, and the importance of that. What are those practical things? Like what are your sort of tactics, and how do you deal with obviously staff? And Angelica sort of touched on it before, and we'll come to Angelica next. What are you doing sort of on the floor? What are the education programs, and how do you deliver those internally now?
So since the beginning of last year, we've been rolling out training around the strengthened standards and trauma-informed care, substitute decision-making, restrictive practices, just the different nuances with that, with the strengthened standards. So we've been doing that, but that's a really big lead time, and that information is forgotten over time. So it's reinforcing that, but we do a lot of toolbox talks and frontline education with our staff, and we're looking at monthly topics around the strengthened standards. And rather than saying to them, this is what dignity and privacy is, it's actually, well, what does it mean to you? And part of the evidence mapping, there's all of the questions that the Commission have in the evidence mapping that we are going to distill in workbooks for our staff. So they're able to say, well, this is how I demonstrate what we do, because they know what they do. They can, and they do it really, really well. But sometimes explaining to an auditor is completely different because it's not a language that they use. So we'll be doing lots and lots of workbooks for staff and trying to make it really practical for them, so that it's something that they can A, integrate into their practice, but B, they can sort of see how they sit within the framework of what we're trying to achieve.
Yeah, fantastic. And Angelica, the same thing to you as well. What do you got planned coming up in the coming months going forward? What implementation and change management practices have you still got to implement with your teams?
So we have started, and then we'll continue using the audits in ManAd Plus against the new standards. So that's a focus for us now, to audit against the new standards using the tools that are in ManAd. And our aim is to at least to go through every single audit once to see where we are, identify the gaps, and then obviously using the continuous improvement plan. And the identified gaps will go in there. They will be allocated to whoever team members we are. We will develop some actions out of that and then follow that through until we can hopefully close it out, and then evaluate after a little while to see if it's worked or if it hasn't worked. So so that's our focus now. So as you know, if we don't know what we don't know, right, we don't know what we are doing, so we need to really audit and make sure that we look at everything, our systems, our workforce, how we inform residents, and so on. And another focus is definitely informing residents and bringing them along with us on the journey. We have obviously started that. We sent the letters out and so on, and then obviously there was a backflip from the department. So we now had to inform residents. No, it's not going to happen on the 1st of July. Everything's going to stay in place until the 1st of November. And the way we're doing it, we're using our newsletters that we provide to families and to the residents. And we also have obviously consumer advisory committees. So these things are also discussed in the consumer advisory committees, in the quality care advisory reports that have also relatives in it. So we can't forget, it's not only about workforce, it's also about bringing the residents along with us and the families along with us, and make sure they understand what all these changes mean for them. So that's what we're doing.
That's a great point. And is that they well received, I'm assuming, those committees with the residents and families?
Yeah, that's right. And we're going like even to practical steps, like for example, with the standard in regards to the food. Some residents had expressed a desire to see what's actually happening in the kitchen, and we had we had residents coming in the kitchen and observing how meals are actually prepared, in regards to food safety and this and that and what's involved. And that was a big success. So going down to the practical, to the practical issues as well, and showing residents and families how we're doing things, because for them it's all about their care and the services they receive,
Yeah.
and what they can look forward to going forward, and obviously also about finances, because the first question you always get from every family is how much. So at the moment it's how much, how long is a piece of string. We still haven't got the finals, but yeah, we need to definitely work on those higher everyday living fees to see that we can provide things that residents really want at a reasonable price so they can afford it.
Yep. No, fantastic. Great insights. So time to move on to our questions. So I'll throw across to, I think, Chris, are you there? We got some questions coming in from the chat.
Yeah, thanks, Ben. So we've got two questions that have come in, and the first one might be specific to Angelica. So Katie's asked, they are too due for re-registration at the end of November, and they're not sure which way to go in order to be prepared for this. Have you or Nicola heard anything from the Commission in regards to their plans for November re-registrations and accreditations?
What we heard was that we are accredited against the current standards, because in November it expires and they come usually about 60 days before. And so yes, against the current standards. I mean, I'm sure they will look also how prepared we are, but from a regulatory point of view, they can really only assess us against the current standards, because if it's not finalized, it's not finalized. So whilst we're not stopping with our preparations, we also have to make sure we meet all the current standards as well.
Yeah, perfect. And then just one more, which we've got time for, that's come through for both Nicola and Angelica. So a common theme we have in the sector is clinicians promoted to leadership positions, since they're great at what they do as a clinician, and rightfully so, because we need great role models for the rest of the clinical staff. What do the panelists do to support those clinicians into those roles to make sure they don't get overwhelmed and are actually able to demonstrate great leadership too, rather than just excellence in care?
Not sure. Nicola, do you want to answer that, or?
Thank you. That's funny for you to go. What we've done, and we have promoted people in exactly as you've described. We ran an in-house leadership course that we ran over a year, just about 18 months ago, that everybody went through. We're also putting our clinical leaders through a diploma in business management as well, because even though we felt that we upskilled them from a leadership perspective, there's often things like budgeting and those other elements as part of a business model are something outside of the scope of what their background has been. I'd like to also think that we have our executive management team, that we mentor our staff as well. We are very open door here, and we are very transparent in how we operate as a leadership team. And I hope that that comes through, and we support them just through that sort of kind of organic leadership style.
Mm. And also probably a very relevant topic from what Victoria spoke around coaching as well, and upskilling those people that step up into those positions that have certain skills in some areas, but then obviously need some support to elevate in some other areas, to help then share their knowledge and experience with other team members.
We had sorry, just one comment. We had a new manager who started, and we did one-on-one leadership training with that person, with a leadership coach, over quite a long period of time, to really upskill them so they felt more confident in their role. And I think sometimes an individual approach is necessary as well.
Yeah, definitely. All right, so conscious of time, we've done our questions, so we'll just go through some special offers we've got today as well from Mirror Australia. So we've got 20% off regulatory reforms training. So if you still do need help and want some support with that, please scan the QR code, use webinar 20 to get that 20% off. and we're here to help you and support you with your teams if you still need help with training. Otherwise, we also have a free reform readiness checklist that you can download a copy of to help sort of support you through that process. So similar to what Angelica and Nicola mentioned today around going through a checklist and making sure that you're ticking off all those various items that you need to be on top of. There's a bit of a list in there that you can also download and take off as well from that today. So our next webinar is upcoming. So we're going to be coming off avoiding delivering millions of unfunded care. So this is all around getting your care minutes right. So obviously care minutes is going to be a very important topic for everyone, especially for those in the MM1 category who are potentially at risk if they're not managing their care minutes appropriately with the upcoming reform changes around those. So we'll be doing a session on Wednesday, the 30th of July. So if you are interested, please scan the QR code. Otherwise, there'll also be emails coming out with links and you can register for our upcoming webinar on Wednesday, the 30th of July. And by all means, if there's any other follow-up questions, please reach out to contact myself, Taryn, or Victoria if there's any specific needs around coaching. I'm sure she'll be happy to reach out and discuss what she's able to help with her organisation and to upskill any of your leaders and put together some programs for you as well. Otherwise, I'd like to wrap it up there. Thank you for your time today and everyone joining us for our webinar. Hopefully it was insightful. And if you've got any other follow-up questions, by all means, reach out to any of the team members and we're happy to help. Thank you so much and enjoy the rest of your afternoon.
Bye.